Chronic obstructive pulmonary disease is a leading cause of suffering and death in India. This year, the World COPD Day is being recognized on the 20th of November. It is important for all of us to realize that COPD needs to be diagnosed early and treated effectively to reduce the suffering and the deaths that are associated. One of the leading causes of COPD deaths is cardiovascular disease. In fact, between 30 to 50% of patients of COPD have associated cardiovascular diseases, and this includes systemic hypertension, coronary heart disease, heart failure, arrhythmias, and even strokes. And therefore, if you make a diagnosis of COPD, it is also important to ensure that you look for the presence of these accompanying cardiovascular ailments. Especially patients who have mild to moderate COPD are the ones who are likely to suffer from coronary heart disease for various reasons. First is the shared risk factors between COPD and heart disease. For example, tobacco smoking or exposure to indoor and outdoor air pollution. Also, the inflammatory mediators that are released in the COPD lung enter into the systemic circulation and have the ability to cause damage to the heart. The hypoxia that is present in patients of COPD because of damaged and destroyed alveoli also has a significant impact on cardiac function, because remember that the heart relies heavily on presence of oxygen for its efficient function. And finally, some of the drugs that are used for the treatment of COPD may likely have adverse impacts on heart function. The corollary is also true in the sense that patients who have heart disease will also have a significant impact on lung function. For example, patients who have underlying pulmonary hypertension or right heart failure will have a back pressure that is built into the lung vasculature, causing not only increase in airway resistance, but also causing pulmonary edema, especially if you have a left heart failure. The risk of associated heart failure in patients of COPD is around 4 to 5-fold greater than those who do not have underlying COPD. Especially those patients of COPD who have been hospitalized for an acute exacerbation will actually have a very high odds of having an accompanying myocardial infarction or a cardiovascular event during the first 14 days after the acute exacerbation of COPD. So it's always important to perform investigations such as the pro-BNP and cardiac troponin levels in all patients of COPD admitted with an acute exacerbation. And if you don't treat them, then they'll probably succumb to the cardiovascular disease rather than the exacerbation of COPD. So the heart and the lung, they talk to each other. So as doctors, I think if you see a patient of COPD or you make a diagnosis of COPD, please look for presence of underlying heart disease as well.